everyone, and welcome to the BOJANA MD podcast. On today's episode, I'm going to be interviewing Dr. Aly Cohen, who is a board-certified rheumatologist and integrative medicine physician. She is a leading expert and speaker in environmental health. She is also on the faculty of Academy of Integrative Health and Medicine, UC Irvine, and Southern California University of Health Sciences. Today, we're going to talk about how to detoxify our body from environmental chemicals that could be damaging our endocrine system and our immune system. Dr. Cohen is going to take us through her framework of how to identify our exposures, how to reduce that burden of exposures, and how to support our own body in removing toxins and living a healthier life. I hope you enjoy this episode, and I hope that you take some practical, actionable tips that you can start with today. Welcome, Aly. Thank you so much for doing this.
Oh, thank you for having me, Bayana. I really appreciate it.
So let's just start with, how did you get into environmental health as a conventional physician in rheumatology, internal medicine? You're seeing a lot of patients with autoimmune conditions. Tell me a little bit about what prompted you initially to kind of start exploring this field.
Well, it wasn't by choice. I was actually at the time finishing fellowship. I had left New York and come to central New Jersey, where I was living on a farm with lots of, local farmers spraying pesticides and all those things. Didn't think much of it. Really wasn't concerned. Was still eating pretty, the standard American diet. And my dog, who was our baby, our firstborn, sort of our starter baby, got sick. And he was a 4.5-year-old golden retriever. And I'd really, at the time, so busy, young mom, running around to work and all those things. I didn't think much of it. I thought the dog maybe has swallowed a sock and we'd see it, on the other end or something like that. But when we finally got him diagnosed properly, it turned out he had what was called autoimmune hepatitis. So his immune system had actually been triggered to kind of fight or go against his own liver. And we see this with humans. We see this in a lot of different medical conditions. But essentially, it doesn't happen to dogs. It's very rare. It's also much rarer in golden retrievers than other breeds, if it even does occur. So, at this time, having just trained in immune mechanisms as a rheumatologist in fellowship, I was completely taken aback. I didn't understand how this happened. And so I started, and I realize now, 15 years later, that I was essentially creating an environmental health survey. I was looking at his water and what he was drinking, whether there was contamination, maybe locally. I was looking at his dog food, whether it was contaminated, his red plastic toy in his mouth. And, other things like flea and tick collar, medication we would put between his two, his scapula, and then I kind of would walk away, whether I'd wash it off or not. I was busy. It was a really early time in this study of environmental health, but I realize now that that's what I was doing. And so as I was exploring online different topics about what could have triggered his immune system, I was uncovering a Pandora's box of information, of peer-reviewed literature on chemicals and their exposures in plastic packaging, in air quality, water quality. And I just could not believe that I was learning this material, and this is 15 years ago, with so much robust literature around the world that had been published, and nothing had ever been taught to me on this topic, especially as an immune disease specialist. So that's how I got my start. It was pure sadness, heartbreak, but it really, catapulted me into this area. And it's led to 15 years of work in this area to hopefully now share with the public.
Yeah, I think it's really mind-boggling how over the course of our medical education and training, we really don't talk about this. I first learned about this about 10 or 11 years ago through a mutual friend, Ken Cook, from the Environmental Working Group. He was giving a talk, and at the time, I was just starting as a primary care physician and constantly counseling patients on preventative care, seeing new people presenting with chronic disease, with autoimmune disease, with metabolic health issues. And there was no part of me that at the time had really any awareness of how do I assess for this? How do I ask questions about, are you using plastic water bottles? Where do you get your water from? Have you had your water tested? To what are the containers and toys and all these, different exposures? And that was really eye-opening for me as well to kind of say, oh wow, there's this whole other aspect of environmental medicine, of exposures that we're just completely ignoring, right? And I know that you talk about this in your book Detoxify as well, but there's just such lack of protection for the consumers, for the people, with respect to the ingredients in our food, ingredients in our products. So maybe talk a little bit about that. What are some of the chemicals that you're most concerned about? What are some of the most common exposures, and then how do they affect us in different ways? And I know there are so many, and there are like many thousands of chemicals that are approved here that are not approved in Europe. But let's focus in on some of the actionable ones, some of the ones that you share in the book, and that people can really kind of walk away with saying, okay, I'm going to think about how to lower the burden of these.
Sure. And so when I got started, one of the first researchers I was reading about was Fred von Saal, who basically got BPA out of baby bottles and plastic baby bottles in 2012. So I'll start with that group of chemicals, the bisphenols, because they're the most well-studied, arguably amongst all of the endocrine disrupting chemicals, because it was the first one on the table. We know so much about BPA, even back in the 1930s, when it was used to fatten up chickens in the farming industry, because it was an obesogenic chemical. It actually made adipocytes and fat cells increase and turn stem cells into fat cells. So BPA is something that we actually see much more than we would ever want to think about. We know that it was taken out of plastic baby bottles, but that's just one particular exposure route, is through that particular product line. So that's not allowed in the US anymore. But BPA, comes in all different areas, but mostly through ingestion is the number one area where BPA and BPA's, regrettable substitutions, other chemicals that have been used in its place now, have been used in, again, food packaging is a big area. So every canned food across the country, there's a very, very small percentage that might use oleoresin or something that's a vegetable base. So that adds more cost. But almost every canned food, and even for organic foods, organic drinks, things that you wouldn't necessarily think of, the food packaging is separate from the food regulation in terms of any chemicals and organic certification. It lines the interior of cans. It's an epoxy resin plastic. The molecules are sort of conjoined to make plastic harder, whereas phthalates as a group tend to make plastics a little bit more flexible. And BPA is one of the most well-studied as endocrine disruptor because it can mimic estrogens at very, very, very low doses. It also has potential to affect thyroid gland, creation and metabolism. It also has effects on, estrogen receptors on immune cells, which is why it makes it, considered an immune disrupting chemical as well, as I talk about in the book. But if we give up canned foods to some degree, there's some wonderful studies that show since its half-life, its breakdown is relatively quick, that in 6 to 8 hours, more or less, depending on the host, the person, you can actually remove a lot of BPA from your body, from urine where it's tested, just by simply changing out from canned foods, canned drinks to other food packaging and other choices. This was a study done at Harvard School of Public Health, and they did a wonderful study with 75 participants that only changed out their soup at lunchtime. They were given either fresh soup for 2 weeks with a 3-day washout, and then the same participants were switched to Progresso, and they named the soup in the study. 1 can of Progresso soup for lunch for another 2 weeks, and everything else stayed the same in their diet. It was just that lunch soup. One was packaged and one was homemade without any packaging. And it turned out that they had 1,100% decrease in urinary BPA, which is how it's measured over the course of that experiment. So we know that we can wash it out pretty quickly. We know that it's a large source of our exposure. is through ingestion. We can also get it dermally through, any kind of, plastics that we handle and hold, and certainly thermal receipts like, plane tickets and receipts. If your occupation requires you to touch receipts, you might want to cover up your fingers and just be more conscious, or have them emailed receipts. If you're receiving those, have an envelope in your pocketbook or your bag if it's just, throwing them in so you don't have to touch them. So that's kind of how BPA works.
And I remember you were actually talking about, I don't know if it was BPA exposure, but in your book, you were talking about an example of a patient where you suggested that they wear gloves, and then there was a significant improvement in terms of their exposure. I can't remember what the chemical was, but that's such a good point, because we often don't realize, and I remember, I don't know, years ago, I saw a study that looked at all of the different chemicals that we absorb through our skin from sunscreen, right? Sunscreen is good for us. It protects us from, UV rays and cancer and all that stuff. But then when you actually look at the studies, this stuff stays in our blood for weeks and weeks after we've applied sunscreen. So we have to be mindful of what we're putting on. And oftentimes, like you said, with receipts, with all these things, we don't necessarily pay attention to that, or it's not as intuitive that this is going to get absorbed through the skin. I think that's such a good point.
Yeah, so much of our human body, we've kind of relied on protection from our body from maybe what's modern day exposures, right? And this is reasonable to think, like, our skin is pretty tough. We have epidermis, dermis, and all that, but we have medicines that were designed to get through the skin to our joints for joint pain relief. We have, Dramamine for seasickness. We have lidocaine for numbing. We have a lot of things that are, we're purposely designed to get through that hard shell of our body, so to speak. But we now know that chemicals can, in fact, make their way into the body through our skin surfaces, especially if they have chemicals called pegylated chemicals, so PEG on a label. That's often sort of disguised as sort of a way to get things in through the outer portion of our skin. Personal care products are a perfect example of that. When we have lotions that make your skin supple, that advertising, that marketing, that drive is really about the chemicals that can make its way through the, sort of the outer epidermis. And so they can potentially have higher levels of those pegylated chemicals and other, chemicals that ride with them into the skin. The other example is the placenta. We've often believed that the placenta is so protective to a growing fetus. And unfortunately, we're now seeing this not only from the wonderful study in 2005 by Environmental Working Group that actually looked at 10 random babies across the country and looked at their cord blood and discovered upwards of 200 industrial chemicals in their cord blood when they're born. So we were like basically born polluted, so to speak, everyone. I mean, this was people who the moms were eating really clean, and this is the moms that weren't eating clean. So it's across the board. We know the placenta is not doing as good of a job as we'd hoped. Also for microplastics as well. So unfortunately, I don't mean to scare your audience. I mean, this is just a reality that should motivate us, that should empower us to think about what we put in, on, and around our bodies, because our bodies are sponges and we can't always count on any kind of, oversight, regulation, any of that to really do the job that we need to do in the course of a human lifetime. So I'm very conscientious of promoting regulation. I'm always aware and supporting it, but I do believe at the rate and at the sheer number of environmental toxins that we're managing, it would take way too long in the course of a human lifetime to really be beneficial overall. So I encourage people to do that themselves, and that's why the book was written.
And let's talk a little bit more about BPA and its relation to cancer, right? A lot of women especially are thinking about, how to reduce their risk of breast cancer. We know, when you write about this in your book, right, that there's some association between BPA and breast cancer tissue as well. How much do we know about this correlation is my first question. And the second one, if it's already made its way to the tissue, do we still have the ability to detoxify it, as opposed to, if we're detecting just levels in blood? And has this been looked at?
Great question. So BPA, again, there's thousands of BP, there's a lot of bisphenols, as there are a lot of phthalates, there are a lot of perfluoroalkyls. I mean, these are classes of chemicals that are widely used. They have multiple purposes. They have multiple functions. They're designed for those reasons. And yes, BPA has been found in breast tissue when it's biopsied, both benign and cancerous tumors. We know that, for instance, BPA likes to bind to certain receptors, estrogen, receptors for estrogen. So we can actually mimic estrogen at very, very low doses, and mimic also, but also upregulate receptors, also affect cytokines and their levels, also antigen presentation. There's a lot of different mechanisms where BPA affects the immune system. So that in and of itself, can also predispose to hormone-sensitive cancers, such as breast cancer, but also male cancers as well that are endocrine sensitive and hormone sensitive. So there's a wonderful study that Dr. William Goodson, he was a breast surgeon. He's now retired, but he did decades of work in environmental health, and he did, perform one of the most incredible studies that I don't think got enough attention. And what he did was, he had 28 volunteers. They had no history of breast cancer, but they were very closely related to breast cancer relatives who, and this why they were motivated to do this study. They had volunteered to have fine needle biopsies of their breasts. And all 28 women went through this simple, sometimes painful procedure, but they wanted to have Dr. Goodson evaluate their breast tissue prior to making 28 days worth of changes to their cosmetics and personal care products. They all came back 28 days later in the study, all of them, no one refused, and they had a repeat fine needle biopsy that showed that by changing out personal care products to safer versions with less toxic chemicals, that their signals for cancer development actually decreased. And I encourage people interested in this study to look up Dr. William Goodson, and I certainly did interview him, and he talked about his own studies, not just this one, on my podcast for The Smart Human. So I just think it's a really important topic to be thinking about, that not only do we measure many of these chemicals that are associated with breast cancer. In fact, there's some incredible mouse studies by Dr. Anna Soto. She did a study that actually looked at mice, gave them an environmentally relative dose or exposure that humans would see. And it turns out that their breast tissue actually grew and proliferated in these mouse studies. So we know that it can cause all sorts of changes to breast tissue and mammary glands. But animal studies are certainly the most well studied. Epidemiologically, we know that it's hard to study humans because there's so many confounders and there's so many chemicals that do get into breast tissue, that do get into our bodies routinely. So it's a little bit harder of a lift, but we do know those associations are pretty strong.
That's fascinating. That's a fascinating study, especially with a 28 day change and seeing the pre and post. That's really interesting. It really just goes to show how it's worthwhile making those changes, right? We might not feel the effects right away. And it's hard to quantify. And I know you talk about this too, right? There are not just these chemicals, but also there are the interactions between the chemicals that we don't fully understand. And it's so challenging to design a randomized control trial where there's going to be a perfect environment. I mean, we struggle with this in nutrition research. We struggle with this in environmental toxin research. So we have to rely on these epidemiologic studies, on mouse models, and connect the dots as much as possible. But it's clear that there are these associations. Can we talk a little bit more about some of the other chemicals that you screen for in patients, or you screen for exposures, and what are your concerns specifically with respect to the immune system itself?
So, I talk about a couple of really important patients that I think are very recognizable, so to speak, in the book. And I think that's really important because I talk about what I look for, what I ask, what I'm, sort of narrowing down in order to be able to help and more directly, go after their condition. In general, I will say this, in general, I don't test everyone who comes through my practice for environmental chemicals from an outside lab. I really incorporate a lot of patients' insurance if they have it. I even put those ICD-10 codes in the book because I wanted people to have access to using their own insurance, high deductibles, whatever you have, but at least utilize what conventional LabCorp, Quest, and, labs will be able to study. And typically, most of my screening labs will, start with, whole blood, arsenic, cadmium, mercury, and lead, because those are sort of the most common when we see them in terms of heavy metals. I mean, you can't test everyone for everything. So you want to start with the process by which those chemicals can be remediated, but just by changing out your water filter, by changing out your, fish consumption, your rice consumption, all of those lead to really reasonable changes just from lifestyle when you get those lab tests back. But what it depends on really what persons come in with, and what, if they're coming in with a rheumatoid arthritis inflammatory condition and they've been diagnosed, certainly all of these lifestyle changes can reduce inflammation, can reduce clinical findings. I talk about a young woman named Ashley, and she's very classic for someone who might come through my practice, and also maybe yours as well. And we worked through a lot of different lifestyle activities. She also took in some supplements that I thought would be very supportive, not a lot, and very specific, very high quality. And she may even have gone on to even more medication, or a biologic, or some of the most common autoimmune medications in our system, but remembering that those are tools, just like all these other tools that we're talking about. I am not anti-medicine. I'm about using everything that we have available to us, but starting with things that are tangible and things that we can do ourselves in terms of washing out exposures, but also adding in specific nutrients, adding in specific things that actually increase our body's ability to detoxify from the liver standpoint, from the kidney, lymphatic systems. So again, testing is something that I do as a general rule amongst other tests for nutrition, vitamin D levels, those kind of things. And then we start to narrow down. But an environmental history, and I certainly encourage people to look at the 50-question survey I have in this book, can be used for physicians and practitioners, because it's very common questions, very common exposures that it gives you a starting point.
And I like your point about testing as well, right? 80%, we're taught this in medical school, right? 80% of our diagnosis comes from history, right? So if you take a good history, theoretically, you really should, be getting some guidance in terms of what's going on. I'm curious to hear on the topic of testing. When you check the heavy metals, do you rely on reference ranges versus do you kind of have a zero tolerance of, like, even if I detect a little bit of, mercury, let's say, but it's still within the reference range, less than 15 or whatever the lab range is. How do you, I'm curious kind of how aggressive is your approach to some of these things, and does it depend on the clinical picture of the patient in terms of how much you ask them to restrict, let's say, mercury? Because sometimes they even find that people with we're mindful of stop consuming tuna or switch to low mercury seafood, and I'm still seeing those levels, and we will do detox protocols, but it's not until they completely stop all, like, even those low level exposures, their body seems to have a hard time detoxing. So I'm curious to hear what your tolerance level is for that.
Well, you're implying what I also agree with, is that every human's different, and every human's ability to detox, from anything, even medications and breakdown of medications and what their blood levels are. These are all very variable from not just a genetic perspective, but lifestyle perspective. How much are they sweating? How much are they drinking water? How many medications are on board? Mixture studies, as you said, when multiple chemicals or medications are on board. So there's a lot of variability. The thing about laboratory testing is they do base a lot of the normal values based on NHANES data, which is really how they look at CDC, surveys that are done every 2 years across the U.S. In terms of what people are contaminated with. And that has been changing over the years because we've had more chemicals to test. So we do know that, when they plop out, when they sort of chunk out normals, there's going to be some human variability, no question about it. I think the number one thing, and you might agree, is that I look at change over time along with lifestyle and history. And the reason is that any point in time does not a diagnosis make, right? We know that things could be abnormal lab, maybe someone stored the blood wrong, or it's that too long before it went to the lab, or, maybe someone had a really big sushi dinner and that's why their mercury level just spiked that day, So I think it's really important not to scare patients, to really give them perspective. I mean, our job is really, I see it as a healthcare practitioner, is really to give perspective, and really, make sure that you're not scaring patients into lowering their ability to make changes, but really giving them the idea that their body works for them and that what they do and how they handle that situation, more or less is up to them to some degree, and that you can assist, but that we're going to check that again in, say, a month or 2 months. Low levels are great. From an occupational perspective, I will say that they allow much higher levels to be in people's bodies of a variety of toxic chemicals. And that's allowable because of the work that they do. And I find that really uncomfortable, actually. But I will say that without understanding someone's occupational exposures, where they spend their time, what they're handling, if they're using OSHA measures and precautions, these are questions I've never really heard doctors ask. And I think these are things that we need to, if you're hearing this, maybe, dive a little bit deeper into, because there's a whole world outside of your home. Even in daycare centers where I early on got involved with some of the phthalates that were being sprayed in my kids' daycare 15 years ago. I didn't know there were phthalates. I just knew it smelled awful. And I started to understand how that process works in that environment. With, windows are shut all the time, and people were mixing cleaning products, inappropriately, and they were relying on teachers to do this. And, then they have the automatic sprayers that go on every 60 seconds or whatever. So all of those things, really do change up the makeup of a human body's exposures. And I think asking the right questions really gets to the right answers. And retesting and watching. And that's what I did with some of these patients in the book.
And we touched on this, but tell me a little bit about your framework in terms of genetic versus environmental contribution, right? We know environmental contribution is important, and it's been estimated up to 90% of disease can actually be affected by environmental factors, which is a lot. Right. Tell me a little bit about kind of how you see this in your practice. Do you ever use genetic testing? Certainly I know some of the tests can give us insight into pathways with respect to predisposition to inflammation, detoxification. We also can get this from family history, right? You might see a patient with a strong family history for autoimmunity. Is there anything that you do to treat these patients differently or maybe more aggressively? Because we know, again, there's such bioindividuality, right? So I'm curious a little bit more about your framework on that.
All of what you said was great. I mean, the idea is that I don't do a lot of genetic testing because I don't think I don't think the companies are where they need to be to really give people I think we're getting there. I've seen lots of companies coming through, but there's lots of variations even on the genetic testing that makes me a little uncomfortable. I see, though, by the way, how it can affect even choices in surgeries. If you have a genetic predisposition, whether or not you're going to be allowed to get a bilateral mastectomy or hysterectomy for BRCA genes and those kind of things. But I don't think the jury's out in terms of who can upregulate or downregulate breakdown of certain environmental chemicals. And certainly it's not going to be covered by any insurance. But what I do, I don't mind doing MTHFR genes and methylation processes because it's covered by insurance. And actually, that's a very common blood test you can add. I didn't add that to the book because I wanted people not to get too confused on the topic. But it used to be 10 years ago that would cost a big chunk of money. And now apparently it's much more reasonable in terms of how that goes through insurance. What it actually means in real time. I always look like, well, what does that mean? What does it mean to our day-to-day choices? What it means to me is that you have to almost work a little bit harder to, have a little bit better choices in what your food is instead of not necessarily going with, ultra processed and processed foods because you might not be able to manage some of those chemicals, maybe even going more to USDA organic, which I certainly encourage frozen organics because they're so much cheaper and they're on par with any fresh non-organic at supermarkets and filled with nutrition because they're flash frozen. Then I will also, and I talk about this in the book, really push for specific supplements that I recommend. I call it human fertilizer in the book, which I think every human should really be on in modern day times, since we're so deficient. What I do urge is people know the quality of their supplements if they're going to take them and understand that, for instance, methylfolate is the active form of folic acid. And a smart company, you can almost tell a smart brand, number one, through transparency, third-party testing, but also if you see on the label methylfolin or methylfolate, as folic acid. And I think when you start to be able to understand products, not just supplements, but even cosmetics and personal care, you become a very, I think, informed consumer, and you can start to suss out which products are actually worth taking, spending time on, refilling, spending money, and you will actually save yourself a lot of, lost money in the long run for no benefit, actually no return on investment. So that's how it means practically is you have to work a little bit harder if you have two copies of the MTHFR. Heterozygous, to me is less of a fear, but certainly something to be, thoughtful about. But really, homozygous is where you see more of those changes or inability to break down certain components in our environment.
And I couldn't agree more on the supplements. I'm sure we both get these questions asked all the time, but there's so much direct to consumer marketing. And oftentimes when I'm asked to evaluate supplements, let's say a patient comes in, there's something that they've been taking on their own. And then we go through, and this is what I really use as an opportunity to educate, because so much of the time, like you said, maybe it's not methylated folate, maybe the doses of, let's say, turmeric or whatever might be in their supplement, or quercetin or vitamin D, or whatever it is, maybe the doses are completely irrelevant to what they need or to what's actually been studied. Right. And it's such a pet peeve of mine that, that these things are marketed as, they're going to give you relief and this is going to be, but we really have to. And then of course, all supplements are then clumped into the group of, they're supplements. They don't, but there's such a distinction. There's such a heterogeneity.
There's
what's out there.
I kind of tried to keep my Irish down, my anger down when I was sort of like, going through how to explain this. But, I can't even think of more than maybe a dozen companies at all that I would ever use out of $1 billion industry, because it's just so much junk. Or there's such a combination. I don't even believe in combination supplements, except for maybe a multi that's really excellent. As I talk in the book, that's kind of our foundation, getting all the B's and C's on days we're not going to be able to have, life is fluid. You don't always get the nutrition we all want to have. But combo pills tend to have too little of anything in them to do anything of any value. And so I'm very conscientious, know what you're taking, why you're taking it, what are the outcomes, what's your criteria for success, what's the quality. It's similar to taking medications. Medications aren't a problem if you know why you're taking, what's the outcomes, what's the side effects, what are the alternatives that may be more natural, when do you get off, like what is the success, so similar to our training with Dr. Andrew Weil, he really hammers this home in terms of just what's available and how to think them through judiciously, I think. Supplements versus medicines or both. That's how we need to think of it.
Exactly. And I think that, one of on the topic of integrative medicine, one of the things that I think drew so many of us to the integrative medicine fellowship training and really practicing in this way is that we don't dismiss conventional medicine. We use pharmaceuticals if needed, but at the same time, we look at the whole human. We look at the environment. We really work hard to understand the history, the context, the goals of the person, and then we implement all of the evidence-based modalities that are available. We don't accept modalities without any kind of discernment or judgment, but we also don't reject them without really thinking through. And I think that's really, something that drew me to this approach and that completely transformed the way I practice when I did the fellowship.
Yeah, for sure. And, the concept that, a lot of this early on was called complementary and alternative was then later turned into integrative as kind of the overheading description of what we're trained in. And I think that is just such a huge, important distinction, because it's not one or the other. It's literally integrating the best of all approaches, all healing modalities. Ayurvedic is, thousands of years old. Traditional Chinese medicine, thousands of years old. Cognitive therapy, sauna therapy, exercise. All of these things have made humans thrive for millions of years. Nutrition has been so critical to human health and disease prevention. And yet it's so talked about in such a, I think, under-recognized way. 5 to 8 or 5 even to 12 hours of medical school is focused on nutrition, let alone environmental health topics that we're talking about here. So I think, just understanding that there's no competition. It's what do we have best available to help people, help patients, help ourselves in a way that's very reasonable. So they all add, value.
So let's talk a little bit about kind of some of the practical tips and frameworks that you talk about in the book. I know in the book you mentioned the 4 A's of, how a person should really approach their toxic burden and then what to do about it. So maybe walk us through a little bit, what we should be thinking about, and for people that are interested in diving in, kind of how do they start?
So the 4 A's are a construct that I came up with trying to make it very simple because I teach high school and college and even physicians, believe it or not. And it was just a way of saying, how do you take this really big topic and chop it up in a way that people will find tangible and palatable? So 4 A's stand for, the first one is assess. We need to kind of assess where we're starting from. It's a great place to begin, which is, if you want to take the 50 question survey that I put in the book, it's very common questions. Do you dry clean your clothes? Do you look up your cosmetics and personal care products? Do you filter your water? It's very simple stuff. It's not judgmental. It's about really just putting down a 1 or a 0, adding up your score, and kind of seeing where you're starting. Because you may find at the end of the process, even at the end of the book, you might have made some real big changes there. The first is assess. The second is avoid or swap. And so avoid really is, do we really need all of the products that we use? Do we really need multiples of products? Do we need like a sink cleaner and an oven cleaner and a carpet cleaner and a surface cleaner and a window cleaner? As an example, we have a lot of cleaning products, that we don't often really need. I have do-it-yourself recipes for surface cleaners and, all sorts of things. But the idea is, do we need to buy so many products? Because within those products, there are just so many chemicals, often even disguised under perfume and fragrance, that we want to avoid. Or we can swap what we really want to safer versions of what we like to use, whether it's makeup or cleaning products or whatever. So assess, avoid, or swap. The third A of the 4 A's is add. What do we actually need to add into the human body to thrive, to work properly, for our cellular health, making our organs work better, helping to detoxify us? So I start with clean water. We want to be thinking about clean water because our bodies are made up of water, 85%. We want to get that right, whether you filter from a pitcher or a fridge or all the way up to reverse osmosis. There are plenty of choices, plenty of price points, plenty of ways to think about it. But also food. What are we eating? Not just what we're avoiding, but what are we eating nutritionally? What are the compounds in certain foods that we actually now know have been studied to offset some of the epigenetic changes from exposures to many chemicals, whether it's folic acid, B9, that offset BPA, whether it's selenium that can offset some of the heavy metals in the brain in terms of exposures, quercetin, vitamin C, being iron sufficient. All of those things are really healthful to offsetting our exposures that we can't always control. Adding in exercise for sweating, adding in sleep, both quality and quantity, to allow for the lymphatic system around the brain and spinal cord to wash out. We have great science on this, to really show that we have a mechanism by which we can manage chemicals through just proper and quality sleep, but adding in even supplements that we've been missing. So there's a lot of things to add in that really bolster our body's ability to manage the situation of environmental health. And then the last A of the 4 is allow. And I put in allow because, I really have been doing this for a long time, and I was very upset in the beginning and really stressed out over all these things I thought I had to change, all the way till now. 2 teenage kids, life, working hard, wanting to color my hair, maybe wanting makeup or going traveling or birthday cake. We need the allow to say that this is not perfection, this process. This 21-day plan in the book, which is really, I think, useful and practical, is not perfection. It's about getting started. It's about a journey for each of us individually. And that we want to feel empowered, to move forward with every additional change that we make, and there's no rush. So the allow is life, And I think that that's needed psychologically, I think, to do some of the harder lifts that I talk about in the book. So it's just giving a perspective and not making people feel shamed or regret, especially if you have a kid with, maybe some disabilities, or you have, cancer you're managing, or any of the number of things that life brings us. This is not about shame or regret. It's about doing better when you know better. When you know better, you do better. And that's kind of how I went from hot McDonald's drive-through, deluxe breakfast every morning as a pregnant mom to where I am now. So still with the colored hair, but I've worked on so many other things.
Right, exactly. It's a give and take. And, it's funny because it's interesting in the clinical setting, I think, too, as we work with our patients, there are all these different areas of lifestyle that we recommend. So there's nutrition, there's exercise, the sleep, stress management. And as we get to the environmental part, it's like, what? There's more, And so I think that a framework is really important, and emphasizing the fact that it's about the journey. It's not about perfection. It's about doing what you can. And it's kind of like, 10 years ago when I first got introduced to this, I really was just like, oh my God, I need to change everything like right away. And what I now tell people is, okay, let's start with, when you're, whatever the personal care products, let's say, when they run out, then make sure, your next one is, you can use the Healthy Living app by EWG. You can use so many resources to look at, okay, what are the cleaner brands? Okay, once this expires, okay, I have my new thing that I'm going to try, or phasing out plastic containers, phasing out some of these things slowly. But yeah, there is a balance, right, between being mindful of it and removing some of these things, and just knowing, okay, I know in the book you talked about, in an effort to reduce the toxic burden from your own water supply and for your dog, you talked about, I was getting plastic water bottles, and I thought, okay, this is going to be better quality water, and then I realized the plastic is leaching into the water, and so I can't do that. So there, it's like you said, it's a journey. It's kind of like a step by step, and it's not to say that you're never ever going to have a plastic water bottle, but just knowing that, okay, let's prep for and plan for other kind of a different system.
It's an awareness, and to your point about the plastic water bottles, even when you choose plastic water bottles, I just posted on the Smart Humans, my platform for Instagram. I was traveling and I had a whole wall of plastic bottles in the airport. And even amongst that choice, I could choose, when you pick off the bottle, you can actually see ingredients. Most people don't think that water bottles have ingredients, and it'll tell you how that water was cleaned, whether it was distilled or UV radiated or municipal tap, which is, remarkable that they would even do that, because they're just refilling bottles. You could do that yourself in the bathroom. Or reverse osmosis, and that would be the one to choose because it's so much more aggressively cleaned than other forms of cleaning water. You're still going to get the microplastics potentially, but you have choices as you learn more. You begin to sort of walk through life with a little bit different perspective of how things on and around your body touch you. I even just, as I was saying, I was talking to high school students, and I was just saying, look, you're not going to think about which chemical I'm talking about. I'm not going to be going into depth about toxicology. The take-home message is that your body is a sponge, that in modern day times, we have these chemicals that were never tested for safety or toxicity. They are pervasive. They're in all the stuff we love, me too. And you're going to go through life thinking about what hits your skin, what you use for tampons, what you put in your, what you drink, what you eat. And you should be thinking a little bit more than just taking it for granted, because some of those things could hurt you. And I think when you just kind of take that messaging, even to patients who may not understand or know of anything about this, like I didn't years ago, you didn't, I think you're stepping along this journey with them. And I think that's the best way to teach anything, is to really get to, meeting them where they're at.
Yeah, definitely. I agree with that. I think that's a great take home message of meeting people where they're at, and people that meeting themselves where they're at, not feeling shame or guilt, but really just knowing that when it's time to make a choice, just making that informed decision. Well, thank you so much, Aly. This was really informative, and I know that a lot of people are going to benefit from this. And I loved your book, Detoxify, that talks about here. It's in focus now, where so Dr. Cohen really dives deep into some of the examples of how people have detoxified their environments, improvements in their health, but also how you can really take action and make specific choices to apply the 4 A's to really reduce that toxic burden, to support your body to detoxify better and really lead to better health.
I really hope people, first of all, enjoy this conversation because I did. It was really a pleasure. I love talking to like-minded colleagues who get it and are doing great work. People can follow The Smart Human on Instagram, on TikTok. I have a podcast myself called The Smart Human, but it's really geared towards environmental health. It's very specific. We have a lot of colleagues. You should come on as well. We have colleagues in, integrative endocrinology, integrative cardiology, some of that stuff. But if people want to do actually even courses, I've started to throw up courses on thesmarthuman.com for heavy metals, for EMF radiation, for integrative rheumatology. I think I did a detox one. So you can get a little bit deeper if and when people are ready. They can start to take some of those courses that I think are pretty comprehensive but easy to understand. And you can always find me in Princeton, New Jersey, or on telemedicine. I'm here in New Jersey as a integrative rheumatologist. So, find me if you need me.
Thank you so much, Aly. All information in this video, including but not limited to the video itself, the audio, text, graphics, images, and other material contained in this video, is strictly for informational purposes only. The content is not intended to serve as or be a substitute for professional medical, pediatric, or psychiatric advice, nor is it designed to suggest any specific diagnoses or treatment. Please always seek medical advice from your physician or qualified healthcare provider regarding any medical conditions, questions, or treatment, particularly before making any changes to your healthcare regimen, medications, or lifestyle habits. Never disregard professional medical advice or delay seeking help from a healthcare provider due to something you have heard, seen, or read in this video or audio. Reliance on any information in this video or audio specifically applied to your own case is solely at your own risk.